Okay, anyways, so speaking is all about, you'll be giving to you'll be given two cards, and then you will have to speak with the patient. Sometimes it can be a relative, and sometimes, most of the time, it is the patient, but sometimes it can be a relative of the patient, and you will be given different scenarios. Sometimes you can be given a scenario of an emergency setting, sometimes you can be given a scenario of a clinical setting. And your task is really simple. You have to just read the questions, and sometimes in those questions you have to counsel the patient as well. Okay, for example, if there is a scenario, there's a patient who is on anti-diabetic medication, but he is insisting that he wants to stop the anti-diabetic medication. But now your task is to speak with him, was what is his or her problem. But then again, you will be given the card, and you'll be seen a task where you will have to, counsel that patient that he or she should not stop the anti-diabetic medication. In this scenario, in these types of speaking sessions, they will okay, first of all, they are going to assess you on your language. They are going to assess you on your grammar. They are going to assess you if you are speaking well or not. But they're also going to assess you if you're being empathetic with the patient or not. For example, if you're saying to the patient, you know what, just please don't stop medication, it's useless for you. No, you don't have to be rude. You have to be empathetic. You have to get down to the level of the patient. Sometimes the patient can be very annoying, but in that case, you have to calm yourself. You have to hold your nerves, and you have to be very, very patient with with the guy or the girl, and you have to understand, and you have to, be empathetic, as I mentioned. Now, how do you sound empathetic? You have to play with your tone. Sometimes you have to lower your voice, and sometimes you have to make certain choices of words, just to make sure that patient is not being annoyed, or the patient is not being hurt by your tone, or the choice of your words. Okay, and you also have to tell them, you know what, I understand where you're coming from. I can really understand you're frustrated about it. And or sometimes, you can always improvise. If there is not if it is not given in the card, you can always ask the patient, can you please tell me, why do you want to stop this medication, or what is bothering you, what is annoying you. So it's not an hard and fast rule that you have to just stick to the question. You have to, but meanwhile, you can also improvise to tackle the situation. Okay, now I'll share my screen with you, and it's a very big slide, but I'll try to share screen this way. Okay, I want everybody to tell me if they can see my screen or not. Okay, thank you, Dr. Tavinda. Okay, so this is a slide, or this is what you can say, a PDF file that I have downloaded from the OET official website. Okay, I'm not going to read it all, but I'm just going to tell you some, important things from here. See, so the name is very clear: the ultimate guide to the OET speaking subtest. Okay, before starting, let me tell you, speaking is the easiest subtest of them all. Why? Because it is going to be held at the last of your test. You are going to refresh yourself, eat something, drink something. You're going to relax your mind, and then speaking is the last, I'm sorry, subtest that you are going to be assessed on. So it's really, really very simple. So will you do any speaking with us today? I asked for two people, any two volunteers who want to practice with me today. I want to practice with, one or two of you. Okay, Dr. Tavinda, thank you so much. Okay, no problem, no problem. At the end of the session, I have some scenarios where we will be practicing today. So, okay, you're up. I will keep you in mind, and please don't leave the session. When we will start the practicing, I will ask you to open your mic so you can practice with me. Will that be okay with you, Dr. Tavinda? Okay, perfect. Okay, so coming to this PDF file is the ultimate guide. See, what are the contents? Let me just, yes, okay. So what are the contents about the clinical communication, indicators of understanding and incorporating the patient's perspective. As I mentioned, that you have to get down to the level of the patient and try to understand why they are frustrated, or forget about frustrated. If the patient is asking you some question, try to understand why he or she is asking you that question. Okay, indicators of providing structure, information gathering, information giving. Okay. uh okay, so what's next is, wait, uh okay, so as we go down is introduction, the 5 clinical communication criteria. Okay, please understand this relationship building, how you can build your relationship. First of all, you have to introduce yourself to the patient that my name is Dr. Kashif. I'm one of the junior doctor, or I'm one of the physician working in the emergency department or the clinic, and today I'll be receiving you. Today I'll be receiving you. I'm really happy to help you. How can I help you? So this is how you introduce yourself, and this is basically how you develop your rapport. This is how you develop your relationship with the patient. Okay, and then the next is understanding and incorporating the patient needs. Told them that you are going to be help them, you're going to assess them, then the patient will ask you some question. Then try to, for example, the patient asks you that, doctor, I want some antibiotics because I'm not feeling well for the past 3 days. Now try to understand. Don't just stop him. Oh, no, 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 antibiotics are not healthy for you or whatever. Try to understand. Ask him, okay, I understand, what exactly is the problem that you are facing, and what exactly is bothering you, and why do you want to start antibiotics? Maybe there is some information. Maybe he was having antibiotics in the past. Try to understand the patient's perspective. Okay, providing structure, it just means, what, you will be given the card. In that card, the structure is given. You just have to follow that. Do not jump around the questions. Stick to the questions format. Stick to the question, I would say, order. Do not ask the third question in the first place, and do not ask the last question in the first place. Try to follow that structure. Information gathering, again, as I told you, if the patient is asking you something and telling you something, try to understand and try to gather information as much as you can. What is his problem? Why is he or she asking for that specific medication, specific disease? If he or she is asking about any disease, maybe he or she is asking about information related cancer, but you have to ask him, why are you so worried about the cancer? Maybe he or she is having any family history of cancer. So always try to gather information. And then information giving. Okay, so this is one of the things that people get confused, or people are really scared about, that we do not have good memory, we do not retain so much medical information, and in the exam scenario, in the exam scene, we tend to forget. So it's really okay. Whatever the disease, whatever the problem you are going to speak about, the information, the related information will be given on the card. For example, if you have to counsel the patient about, let's say, tuberculosis, so the information about the tuberculosis will be given in the card. Enough information will be given that you can um, tell the patient and counsel them. So enough information will be given. So don't worry about that. If people say, or if you are someone who tend to forget, it's really not that important. Okay, what will be the outcome of an OET speaking test? Again, it's an opportunity to build familiarity and proficiency in the skills you will need when working in an English speaking workplace. Again, this workplace is referred to the healthcare environment. It is not referred to any other workplace. Like, for example, OET, I'm sure everybody knows it is for healthcare professionals. Okay. What are the indicators of relationship building? Again, as I told you, the most important is initiating the interaction properly. How do you do that? You introduce yourself. Okay, you tell your role. You tell them that you are going to take care of them. Okay, and then is demonstrating an attentive and respectful attitude. Again, as I already mentioned, that you do not have to rush information, or you do not have to be judgmental about the problems of the patient. Try to be very attentive and try to listen. Whatever the problem they are saying, try to just keep an eye contact, nod, and do not listen to their problems, and then try to ask them what exactly is going through, adopting a non-judgmental attitude. So for some people, this they will say, what, it goes without any saying that we have to be non-judgmental. But because everybody comes from a different cultural background, different healthcare background, So it's not always the case that people have a non-judgmental attitude. People do have a judgmental attitude, especially people working in the South Asian country. We tend to have the judgmental attitude, so we have to, you know, once we are in the exam, we have to, just shake it off. We do not go with the judgmental attitude, or otherwise we will mess up bad time. And the last one is showing empathy. So it all, I have told you all of this already, that these are very important things. Okay, you have to introduce yourself, you have to listen attentively, you have to keep a non-judgmental attitude, you have to show empathy. As I said earlier, how do you show empathy? It's very simple. You have to nod, you have to keep your tone low, and you have to understand what patient is coming from. If he or she is saying that he or she is really worried about cancer, then you say, okay, I understand that cancer is a big deal, and I can also understand that you do have a family history of cancer or tumor. So this is, one of the example of showing empathy. Just few slides and then I'll switch to another PDF. To understand what is or is not appropriate, you will need to consider what the setting to your conversation. For example, where is the conversation taking place? Again, are you visiting the patient at home, or have they been hospitalized? Is it emergency? Each of these situations would require a different way of starting the conversation to demonstrate that you're aware of the setting. As I mentioned you, that once you introduce yourself, you have to introduce. For example, if you are in the emergency setting, you tell them that I am the doctor. I'm Dr. Kashif. I'm one of the junior doctor working in the emergency. For if you are seeing the patient in the clinical setting, then again you have to introduce, and you will tell them that I am the physician today, that will be seeing you and will be helping you whatever the problem you have. The background of the situation. Again, do you know the patient, or have you met before? Is this the first time you're greeting them? Have you just examined the patient as per the role card? If meeting for the first time, introductions will be appropriate. But if you have met before, then greetings instead of introductions are fine. Finally, if you have examined the patient as per the role card, no greetings or introductions are required. Simply start with the task one and findings of your examination. Okay, I will hold on to this one, and I will tell you what exactly this mean is. As a rule of thumb, always introduce yourself. Always. Okay, doesn't matter if the setting is in the emergency setting, doesn't matter if the setting is in the clinical setting, or doesn't matter the setting is at home. Always introduce yourself. Okay, having said that, if your role card is that this patient has been admitted in the ER, you have been told to perform a, let's say, mental state examination of the patient. Now your task is go up to the patient and tell them that they are fine and they are ready to be discharged. In this scenario, now you are going to explain the outcomes of the result or investigations that you have been, or that you have ordered, while keeping the patient in the ward or in the waiting area. In this scenario, specifically in this scenario, you do not need to introduce yourself. But how would you start the scenario? You will say, hello, I'm here to explain your results, as we have met before and I have examined you. Now I'm trying to tell you about the outcomes of the investigation. So are you prepared for that, or is it the good time to talk? So in this way, you are great. You always have to greet. But other than this scenario, other than this setting, it's important. Just make it a rule of thumb that you have to introduce yourself. It's always safe, always safe. Okay. Now, any emotional factors. What do you know about how the patient is feeling? Does their background information give you any clues to their emotional state? Perhaps they are frustrated from waiting again, or anxious about possible bad news. If you believe that you know how someone is feeling, try to acknowledge this when starting the role play by offering the appropriate response, an apology for being late, some reassurance about your news, etc. Again, as I said, this is exactly how you show empathy. This is exactly how you are going to demonstrate that you are available emotionally. For example, there may be a card where they will tell you that patient has been waiting for the past 2 hours for any doctor to see him, or for the results of his or her investigation. So when you will start the scenario, you will all say that I'm sorry for being late because we are short on staff and I'm on the call. We are only two doctors and we are equipped with so much other tasks. So I'm really sorry for being late. While you are waiting, sorry, you tell them, I apologize for being late, but here I am with your results, or here I am to see you. Can you please tell me what exactly is going on with you? And even if you have apologized, the patient may be frustrated. They will say, you know what, I do not need your apologies. I have wasted my 2 hours. Again, you acknowledge that I'm really sorry, but now as I'm here, I will try to, what I will try to answer your queries. I will try to see you, and I will be as fast as possible. I will try not to waste much of your time again. Okay, so this is how you make sure that you're empathetic and you're attentive, and also you're acknowledging whatever there is. Okay, so the other thing is why you're having this conversation again. Are you providing any advice? Are you providing any test results or diagnosis? The nature of the conversation? Are you offering an explanation, treatment options, or reassurance? Clarifying what you plan to discuss at the beginning of the conversation can help ease someone's anxiety. It will also allow them to process their thoughts and positively contribute to the discussion. Again, as I said, for it all depends on the card. I will tell you how to do this all. Okay. So these are some examples. Just, we will skip these. I will share this file with you in the group, and you guys can go on to see this file on your own. But it's just explanation. Okay. Wait, I will share another file with you guys. Meanwhile, do you guys have any question? Please type in. While I open the other file, please type in any questions that you guys may have. No questions so far? Shall I share the other slide or share the file? No questions so far? Anybody, do you have any questions or not? I guess not. Okay, no problem. That's good if you guys don't have any question. Okay, so the most important thing now, how you are going to be assessed while, you know, you are speaking. So first of all is linguistic criteria. This is, again, this is the file that I have downloaded from official OET website. So first of all, you are going to be assessed on linguistic criteria. Okay, what does that mean? I'm sorry. This means that, see, this criteria refers to the ability to produce comprehensible speech. It includes such as features as pronunciation, stress rhythm, accent. Assessors consider whether the candidate pronounce words, sounds clearly, projects pitches the voice appropriately, use intonation and selective stress effectively, appropriately, produces a natural English sentence rhythm. Okay, what does that mean? This means that, in short, if I have to tell you what this means is that if you are being clear to the patient or not. So as I mentioned that there are different types of people coming from different backgrounds, different countries, and different areas. Everybody has a different accent. Not we English is not our native language. If it was our native language, we would not be sitting this test. Okay, so first of all, it's really important that you are clear to the patient. Doesn't matter your accent, doesn't matter your pronunciation. As I told you that some people have different pronunciation. So as long as you are being clear to the patient, you are being understandable, doesn't matter. Okay, all it matters is if your speech, if your pronunciation is being understood or not. That's it. For example, I will give you an example. This is features. You do not have to pronounce it as at futures or feathers or something like that. Okay, this is what I mean. Next is fluency. This criteria refers to the rate and flow of speech. Assessors consider whether the candidate speaks at a normal rate, not too fast, not too slow, that can easily be understood, continuously and smoothly with pauses or hesitations that are situationally appropriate rather than a sign of searching for words or structures. Okay. Now, what does this mean? I think it's very self-explanatory that you have to keep your rhythm, you have to keep your rate of speech appropriately. That is appropriate to the scenario. For example, if you are talking to the patient, if you're trying to explain any kind of disease to the patient, and if you're rushing, antibiotic diabetes is the type of disease that is being that is due to the problem of insulin in your body, and you're going cramming like that. No, again, as I mentioned, anything that you have to explain will be given on the card, and you have to be not very slow and not very fast, but at a very medium pace. You have to explain to the patient, you have to talk to the patient, and it's a good idea if you pause in between and you ask the patient, am I being understood, do you have any questions, do you understand, and what I'm trying to say, it's appropriate. You can take pauses. Okay, this is how we talk, this is how we naturally talk. Okay, so this is what fluency mean. Next is appropriateness of the language. This criteria refers to the ability to use language, register, and tone that are suitable for the situation and patient. In particular, assessors consider whether the candidate uses expressions comprehensible to a layperson in explaining technical procedures or medical conditions, and adopts a tone of voice suitable to the situation with the flexibility to adopt as necessary. Again, as I told you, that you have to adopt your tone, you have to play with your tone. Now, the most important thing here is that if you are using the late, if you're not using the medical term, for example, what is the medical term that I can tell you is some people, CT scan, for example, CT scan. Some people may not know what is CT scan. What CT scan is? Somebody who is not very educated, somebody who is not from the medical background, may not know the knowledge about the CT scan. So you can always use a lay term, language. You can tell them that we are going to have you scanned, we're going to scan your brain, or we are going to take an image of your brain to a machine, which will tell more about the disease, or which will tell more about the process, or anything that is going on in your mind. We will bombard some rays, and there will be a picture that will be formed, and upon looking at that picture, we can tell you further, we can assess you further. So this is how you use lay term language, and it's very important. Please do not use any medical terminologies, because if the assessor, because they will ask you, doctor, I don't know what does that mean. If they have asked you, you have deducted some marks. Okay, you are going to lose marks. So please do not use medical terminologies. The next is resources of grammar and expression, refers to the range and accuracy of candidates' linguistic repertoire. Assessors consider whether the candidate's vocabulary and control of grammatical expression are adequate to express necessary ideas clearly and unambiguously, and whether any defects from a barrier to communication. The candidate can paraphrase when required. The candidate has the capacity to maintain longer utterances rather than single sentences with appropriate uses of cohesive devices, can use idiomatic expressions accurately. Again, it is something, if you have a good grammar, if you are someone who has already very good hold of English language, okay, you can use idioms, you can use difficult words, you can use, for example, it is highly recommended that you do not repeat many words. For example, if you have to explain something but you use but, no, you can use subsequently, consequently, rather than this. Okay, so these are sometimes of the things that I would recommend that you guys please use these rather than repeating one thing. For example, when I'm teaching you, I use for example a lot. So if I want to substitute it with another word, I would say for instance, and or I can also say another example is. So these are the things that you have to pay attention to. The next is clinical communication criteria. Indicators of relationship building, again, as I told you, that initiating the interaction appropriately, creating introductions, nature of the interview, initiating the interview appropriate, helps establish rapport and a supportive environment. Initiation involves greeting the patient, introducing yourself, clarifying the patient names, and clarifying your role in their care, demonstrating an attentive and respectful attitude. I'm not going to read it all, I'm just going to read the heading. And demonstrating a non-judgmental approach. We have talked about it. Showing empathy. We have talked about it as well. The other is indicators of understanding and incorporating the patient's perspective, eliciting and exploring patient's ideas, concerns, expectations. Have let's have a read to it. Understanding the patient's perspective is a key component, okay, of patient-centered with healthcare. Each patient has a unique experience of sickness that includes the feelings, thoughts, concerns, and effect on life that any episode of sickness induces. Okay, patient may either volunteer this spontaneously as directed statements or cues, or in response to healthcare professional inquiries. As I've told you, that if the patient is asking you something, always ask why you are asking. Is there anything that you're bothered about? Do you have any past experiences? Always explore the reason, because nobody asks you any question without any reason. Okay, please try to understand this. Taking the patient cues, if the patient is giving you some cues, for example, a patient who have been going through some kind of trauma may not be very open to you, they may not be maintaining an eye contact with you, their tone will be low. So these are the cues that you need to understand, that patient is not very cooperative and he or she is hesitant to share information. In that manner, you have to, pick up that cue and ask them what exactly is wrong with them, why they are not opening up to you. Okay, the next is sorry. Yeah. So the next one is, again, some of the techniques for picking up cues would include echoing, repeating back what has just been said, and either adding emphasis whether appropriate, or turning the echoed statement into question. For example, something could be done. Another possibility is more overtly checking out statements or hints. For example, I sense that you're not happy with the explanations you have been given in the past. Okay, then is relating explanations to the elicited ideas, concerns, expectations. One of the key reasons for discovering the patient's perspective is to incorporate this into explanations, often in the later aspects of the interview. If the explanation does not address the patient's individual ideas, concerns, and expectations, then recall, understanding, and satisfaction suffer, as the patient is worrying about their still unaddressed concerns. What does that mean? That mean is, you always have to check, you always have to make sure that whatever the concern of the patient is, if it is being answered or not. For example, the patient says that, I want to, what can we say? Let's, okay, there's a patient who is coming that, he's saying that I cannot see clearly, and you're telling them, okay, I can understand. What we will do is, we will try to do some refractive test on you, and then we can see maybe you will needing VR glasses. And then you have stopped, and then you moved on to another question, but you haven't asked the question if that's appropriate, if he or she is happy with that. Maybe they have other question, that what exactly is a refractive test, and why they are not seeing very properly. If they have any refractive error, what is the issue? If they are being, if you will prescribe them any spectacles, glasses, what kind of spectacles or glasses will they need? Will they be needing it for lifelong or not? Will it be short term, long term? So these are the questions that patient may have in their mind. So it's always necessary to counter check whatever you say. You make sure that the patient, it's always necessary that patient is understanding that, and always good idea to ask them that, is it clear? Do you have any questions? Am I being understandable or not? Okay. The other is indicators of providing structure, sequencing the interview purposefully and logically. It goes with the card. Follow your card, follow the order of your questions. Is as simple as that. Signposting changes in the topic. Yes, this is important. Let's read it. Signposting is a key skill enabling patients to understand the structure of the interview by making the organization a word not only the health professional but also the patients need to understand where the interview is going and why. A signposting statement introduces and draws attention to what we are about to say. For instance, it is helpful to use a signposting statement to introduce a summary. Signposting can also be used to make the progression from one section to another and explain the rationale for the next section. For example, if you're given card and the first three questions are ask the patient what he or she is going through, and the fourth question is now tell them what are the relevant investigations you are going through. So after the three questions, you will tell them, okay, now that I have taken history, now that I have an idea of the situation, what you are going through, now we will talk about the type of test or the type of investigation that we may order in to have a better knowledge of what is going through, to have an understanding of what is underlying, or what is the process that is underlying in your body. So it's always good to signpost the next question, or whenever you are shifting from one I would say section to another section. For example, the one section is where you are just taking history, the next section is where you are explaining the results, and the other is where you are going to explain the type of treatment they will need. Okay. The other is using organization techniques in explanation. Again, it you have to avoid repetition. So just forget about it for now. Okay, the other is patient's narrative with active listening techniques and minimizing interruption. Again, it's very important. As I said, you have to nod, you have to make an eye contact, okay, and you have to always keep and maintain a silence. And you have to you can also say, since here it is verbal encouragement, you can always use words, okay, just to make sure that you are present in that moment and you are not lost in that moment. Okay. The other is using initially open questions, appropriately moving to the closed questions. For example, if the patient is telling you that I'm having a pain in the chest, the open question is, can you tell me more about that pain? Then the patient will explain more that this chest pain has started last night. It has been going through. It is not relieved by any medication. And then after he or she has explained something to you, then you move on to the closed question, that for how long it has been going on. Is it going from one place to another? And is it the first time that you're having this pain? Do you have any underlying disease? So always try to initiate any question with an open question. And what a safe open question is, can you tell me more about it? It applies to any situation, whether the patient is having pain, whether the patient is having any kind of disease, or he or she is there for information. So it's a safe question to ask, can you tell me more about it? Okay. The next is not using compound questions, leading questions. Yes, this is very important. For example, if the patient is saying that I'm having chest pain, a compound or leading question is, do you have any shortness of breath with it, or do you have any problems in your breathing with it, or do you feel numbness in your chest? You are leading the questions, and while you are asking a leading question, you may miss another, or you may miss other important information. Okay, so do not always ask open questions and then ask closed questions. Okay. And the other is clarifying statements vague or need amplification. Okay. What does that mean? Is clarifying statement which are vague or need further amplification is a vital information gathering skill. After an initial response to an open-ended question, healthcare professionals may need to broaden to certain which one is intended. Okay, I think this is self-explanatory. And then is summarizing information to encourage corrective, invite further information. For example, once you have taken the history, now you can summarize the patient that you have. So far, you have told me that you are having chest pain since last night, and it is the pain is there, it is not radiating anywhere, and this is the first time you are experiencing this type of pain, and with this pain you are sweating a lot and you're having problem with shortness of breath. You have summarized, and now you can ask, is there any other information or is there anything that I missed about it? Simple. It's as simple as taking history. Okay. The last one is indicators for information giving. I will just read the headings, and if there is anything important, then I will read the other thing. Establishing initially what the patient already knows. True. If the patient is saying that, if the patient comes with a problem, again, I'm giving an example of tumor. You can ask, what do you know about tumor? What do you know about the breast cancer? For example, there can be a female coming with a problem, or you know, information about breast cancer. It's a good idea to ask them, what do you know about the breast cancer? Why do you want to know about the breast cancer? Pausing periodically when giving information, using the response to guide next steps. Yes, when you are bombarding information to the patient, it's always important to pause and to make sure that the patient is retaining that information. And in between, you can ask them, am I being understandable or not? Or do you understand me? Or are you there with me? Is there any question? Okay, encouraging the patient to contribute reactions and feeling. Again, this is the same thing. You can ask them and you can tell them, are you comfortable, and do you need any water or something like that? Checking whether the information, whether the patient has understood information. I have already mentioned that. And discovering what further information the patient needs. Okay, it all goes without saying. We have discussed this all. So I will give you a scenario right now, but before that, before I give you a scenario or I show you a card, I want to know, is there any question or is there anything that you guys want to ask or that you haven't understood so far? Please tell me. There are 12 applicants, sorry, 12 participants. So I need some feedback. I need to know, do you have any questions or not? Are you there with me? Are you getting me or not? Dr. Ravinder, do you have any questions or what exactly are you saying? What is ecoback? I don't understand ecoback. What do you mean?
To ask you one thing that when my husband was having the exam, he said that you should echo back the information of the patient. Like I don't understand it why what he was saying.
Echo back, okay, I understand, I understand. See, echo back means that information, for example, you're a patient and you're telling me that you're having pain in the right leg, and it has been going on for the past 3 days, and you have tried some answers by yourself, and the patient and the pain is not relieving. So now you have given me this information. Again, as I mentioned, echo back means to tell them what they have told you, summarize it. That is what echo back means to the patient. So in that manner, you are showing skill that you're attentive, and you're also showing the patient that you have retained the information, and now you are trying to explore more of it. That okay, this is what you have told me so far. What is other? Do you have any other problem or not? And if he or she says that no, we don't have, I do not have any other problem, I do not have any other complaint, now you start with the treatment or you start with the investigation. So that is what ACOBAC means. It's, you have to summarize, okay? And this is not for the test. I think it's very important when you have, whenever you are working in the healthcare setting, it's always important to, summarize the complaint. If you are going to take exams like PLAB, like MRCP, in those exams, it's very important in the OSCEs, it's very important that you do this. Otherwise, you're going to fail those stations. Anybody else? Do you have any other questions? So Mahesh is asking, echo back only after major complaint or at the end of the session? It depends. Okay, so for example, if the session is about history taking, and there are 5 questions, 3 questions are related to the history taking, and the last 2 questions are about investigations or treatment. So it's a better idea when you have completed taking the history. Okay, So you will have an idea, okay, now at these questions, I have taken the history, or I have listened to the complaints of the patient. At the end of that, you have to echo back. Okay, it does not matter after major complaint or at the end of the session. At the end of the session, you will always echo back at the end of the session, so that you will know that the session is going to be end. So it's not a good idea to echo back at the end of the session, but it's a good idea to echo back at the end of the history taking question. Okay, at that step. Any other question? Any other candidate? I will try to call some candidates. So, Dr. Salman, I do not want you to panic, but are you there with me? Are you actually attending the session or not? Okay, perfect. What about Sadia? Are you there? Are you attentive? Are you in the session? And same goes for Khatija and Kulsum. I want to know that everybody is awake, everybody is attending the session. Kulsum and Khatija, please type in if you are there, please. So I have an idea. And Dr. Ikra, please. Dr. Munesh, Amjad, please, guys, just type in something so I know I have called your names so I can know. Okay, Khatija is missing and Dr. Ikra is missing. Khatija, okay, thank you so much. What about Dr. Ikra and Dr. Mansha? Perfect. Okay. Okay. So now that I have, call everybody name, do you guys have any question? Because right now I will start. Someone said that in speaking your role can be doctor or patient both. Is it true? Someone said that in speaking your role can be. No, it cannot be both. Salman, whatever this is a wrong information. This is misinformation. Okay, in the speaking session, you will always be the doctor. Always, you're always going to be the doctor. The assessor, your assessor or your invigilator will always be the patient. Okay. Okay, so I have one volunteer, which is Dr. Tabinda. I will practice with her. Do I have any other candidate who is up for practice? See, guys, I'm not going to assess you. I'm trying to help you here. If there is anyone, I am more than happy, because in that manner you will build confidence as well, and you will get to know how to take on these speaking sessions as well. Other than Dr. Tabinda, do I have any other candidate who is up for this? No. Okay, no problem. Okay. So can you guys see this card on the screen? Can you guys see this card? Okay. Thank you, Khayyam. Thank you, Ikra. Okay. So, Dr. Tabinda, I have your attention, please?
Yes, sir. Yes.
Okay. Okay. So I want you to practice this card with me, but do not panic. We will do it together. Okay.
Yes, sir.
Okay, so you can see below, let me just mark it here. You can see this candidate card. This is your card, okay? This section is yours. I have purposely not hidden this part because this is our first session, so I do not want to, go hard. So, okay, Dr. Tabinda, you have 2 minutes. Oh, okay, let's do not have your 2 minutes. Read your card. First of all, read your card. What is the setting? The setting is, please can you
Emergency
read
department.
it out loud?
Department.
Okay,
The,
go on, read the card.
the parent presented 2 hours ago at emergency department with his and or her 4-year-old son. The child has 36-hour history of stomach pain and
Yes.
pain, and which was diagnosed as viral gastroenteritis. He was given oral rehydration fluid and observed for 2 hours. He is now ready to be discharged. The child is not present for your discussion with the parent. Task: confirm child is ready to be discharged. Find out the parent's concern. Explain viral gastroenteritis, irritation of the stomach or intestine due to viral infection. Give information about gastroenteritis spread. Contact
Okay,
with the
okay,
mom.
okay, okay. Enough, enough. Now you have understood. Okay. Now, as I will be the role player, you are the doctor. Now I'll
Yes.
read the role play card. Okay, the setting is emergency department. I am the parent of a 4-year-old boy who came to the ED 2 hours ago after 36 hours of recurrent vomiting and stomach pain. The doctor told me that my son had viral gastroenteritis. He was kept in for 2 hours on oral rehydration fluids. My son is not present for the discussion with the doctor. Now, what is the task? See, this is how role play card looks like. When asked, say you still don't really understand what viral gastroenteritis is. Again, as I mentioned, you please do not use medical terminologies. But again, as it's given in the card, some doctor have told the parent that his son is having viral gastroenteritis, and it is given in the task that say you do not understand what is viral gastroenteritis. And again, in the below in the candidate section, you can see that information is given that you can tell the patient it's irritation of the stomach or intestine due to viral infection. Okay, now here comes the part where you can score more. For example, while explaining this, you can tell them that there are different bugs. That bug can be viral, that bug can be parasite, that bug can be a bacteria, but this bug is viral. This bug is virus. Okay, so whenever this bug irritates the stomach or present in our body at an unusual place, it causes irritation of the stomach, which eventually leads to the infection. Okay, so the information is given, but now it's on you how you are going to take this information and how you are going to present it, or how you are going to say it to the parent or to the role player. Okay, say again, say is the first task of mine is say you still don't really understand what gastroenteritis is, and the second task is say you don't know how your son got viral gastroenteritis. And here it is give information about how gastroenteritis is spread: contact with vomit, faces on infected person, shaking hands, contaminated food objects, etc. Again, this is information, this is very precise information. But as your doctors, if it is relevant information that you are confident that it is relevant and it is true, please try to incorporate it. It will give you more marks. Okay, now my other task is say your son looks very weak, you really think that he needs to be kept in the hospital. I am emphasizing that please do not discharge my son. And now here comes your counseling skills. You are going to speak, but here comes your counseling skills, how you're going to counsel me on that this one. And then when I say you're concerned about taking your son home, you just don't know what to do if you start to feel worse at home. Okay, so as we can see, the first two questions, okay, are question where you will give me some information. Okay, but the other two questions are, these are not information, but these are the questions where you will showcase your empathy skills, where you will showcase how good of a doctor you are when it comes to counsel the patients. And the last is say you feel better about taking your son home now that you know what to look for and when to come back to the ED department. Now this task is given to the role player card, but please keep in mind he or she will only say this one when they will assess that you have been cooperative with them, you have been a good doctor, you have taken your time, you have addressed their concerns. Only then they will say it. Otherwise they will just say, okay, you know what, I'm okay with my son, I'm okay with my son going home now, and I will just come back to the emergency department. They will not say that they feel better. So this is the task. In exam you will not be shown the role player card, but here I'm giving you an example that this is how a role player card looks like. You do not know what their questions is, but you will understand by their tone or by their questions. Okay, so having said that, Dr.
Yes,
Tavinda,
sir.
can we start? Shall we start?
Yes, sir. Sure.
Okay, so for this one, I'm not going to keep a timer. I'm not going to put a limit of a 5 minutes, sorry, but we will start. Okay, I will just, and other candidates will listen to our conversation.
Okay.
It's okay, whatever the time we will take. I'm here to practice with you guys. Dr. Tavinda, take your time and start the scenario.
So should I start?
Yes, yes, yes. Please go
Hello.
on.
Hello, I'm Dr. Tabinda, one of the doctor in the emergency department. For better
Okay.
conversation, may I confirm your name and age, please?
Sure, my name is Michael and I'm 40 years old.
And I have gathered from your notes, Michael, that you have brought your son here in the emergency department, and
Mhm.
he's 4 years old, and he had recurrent vomiting and stomach pain. Is that correct, Michael?
Yes, yes, you're correct.
Okay, Michael, I have seen from your notes that your son has received the treatment and now he's ready to discharge. Do you know about it?
I don't know. All I know is that he has been kept here for 2 hours, and there were some doctors who visited me, you know,
Mm-hmm.
an hour back, and they told me that my son has some, I don't know, viral gastroenteritis. I don't know what that is. Can you tell me what that is?
Yes, Michael. I appreciate your concern and your question is valid. I want to explain you that what is viral gastroenteritis. It is, the irritation of your stomach by some bug or some infection. Okay, like your son's stomach is being irritated by something, some virus or some bug, so that's why he developed these type of pain and vomiting and that's why this is the cause. Are you getting me, Michael?
I do get you, but I'm not sure how does that happen. He's with me all the time, and he is with me. We try to eat clean foods, and he's always eating homemade foods, home cooked foods.
Mm-hmm.
I don't understand
Mm-hmm.
how he has got this.
Mm-hmm.
As you mentioned that it is some viral disease. I don't understand how
Mm-hmm.
he got this.
Mhm. I can understand, Michael, and I can understand your concern, and I can see that you are much anxious. But I want to reassure you, Michael, that we as a team are here to help you. And I'm going to tell you that how your son get this infection. Michael, look, we can get gastroenteritis by many ways, by drinking some infected water, by by shaking hand with some person whose hand are not clean, and by eating some contaminated food, by touching some other objects which are not clean. Okay, we can get from anything. It's not mandatory that your son is with you, and okay, are you getting me?
Okay. Yes, yes, I'm getting you.
Okay, Michael. So I'm going. I was telling you that we are going to discharge your son, as I can see that your son is better now, and vomiting is also settled, and pain is also settled. So
Yes, but
what
doctor,
is?
as my son is being has been vomiting for the past 36 hours, and he has not eaten anything, and he's complaining of stomach pain. So I think he looks really weak. He is really weak, and I
Mm-hmm.
think it's a better idea to keep him in the hospital while he needs another treatment. As he has been here for the 2 hours, he is getting better.
Mm-hmm.
So I
Mm-hmm.
think it's don't you think that it's a better idea to keep him in the hospital and give him some more
Yeah,
treatment so he
yeah, Michael, you are right, and I can see that you are much worried about your son, and you are upset because your son is looking weak. But I want to reassure you, Michael, that now hospitalization is not better for your son because now your son is not vomiting and there is no pain, and he's able to take oral fluids. So it's better that your son will go home and take more fluids, and we will prescribe some medication, and you will have a clean environment, and you will take care of your son by yourself, and we will tell you how to do this. How does this sound, Michael?
it does sound good, but the thing is, as I am a single parent, if I take my son home,
Mm-hmm.
I'm not from a medical background. I just don't know how to take care of him, and what are the things that I should be concerned about, and what to do if he
Yeah,
worse
I can
at
see. I
home.
can see my Michael. I can feel it, and I can see that you are worried. And we are going to tell you that how you can take care of your son at home, and we are here to help you, Michael. So I want to tell you that first of all, do you want to listen that what how you have to keep your son?
Yes, sure, sure, sure.
Good at
Please tell.
home.
Yes, please.
Okay. First of all, you should take care of your son hydration a lot. Like your son should drink water or drink
Okay.
ORS, and okay, and we are prescribing you some medication also, and your son should take those medication on time. And in case of any problem, like your son is not taking anything, not taking fluid, not able to tolerate fluid, and become extreme thirsty or lethargic, so you can contact us, Michael. Are we on same page?
Okay. Yes, yes, I understand and I do know. Okay. Thank you so much, doctor, for your information. I am happy, I'm confident to take my son home and
Thank you very much, Michael. In
I
case of
know
any
when to
problem,
come
I'm
back to the
providing you my
emergency
contact
department.
number. Yeah, yeah. You can contact us. We have 24-hour contact number. You can contact us. And thank you very much, Michael. Any other concerns?
No, thank you so
Hello.
much.
Thank you. Thank
Hello, can you hear me?
you. Yes, sir. Yes, sir.
Okay, Dr. Tabinder, you have done well. For the first time, you have done well. One thing that I will try to tell you is there is one thing that you are you have done well, but please do not repeat that. I can see that you're concerned. Of course the parent is concerned. That is why in the first place he has presented in the emergency department and he's asking you these kind of questions. It's good to acknowledge once in a while. You can say, yes, I can see that you're concerned, I'm here to help you, but do not repeat this because it becomes a pattern and it's not a good idea when it becomes a pattern. Okay. And other than that, you have done well. You have done well. Just try to be more confident in your speech. Try to do not try not to take so much pauses and drag information. Be very smooth in the conversation. If there is anybody else who will now play the role player and I'll play the doctor, just
Sir,
giving you an.
sir, I want to tell you that I have taken OET before. So I was
I know, I
very,
remember you. I remember
yeah,
you,
sir,
Dr.
I
Tabinda. I
got
remember you.
very less marks. That's why I was concerned that why I got so much less marks. So
Because
my husband was saying that you are not natural, and you, sir, I memorized the lines of, from YouTube.
no, it's
So
not.
maybe that
See, this
it
is
was.
this is not a good idea, Dr. Davinder. See, the one thing is, I can now you have practiced with me. I can totally understand that you are not becoming natural. How can I tell you that? Because you're taking too many long pauses, and when you are transitioning from one question to another, there is a sense of I would say what some lack of confidence and there is something lacking in your conversation. I can totally see that in your conversation, in your approach. Okay. And that is why I'm trying to tell you that be very smooth in your conversation. Do not try to repeat the same sentence that I can see your concern. Just try to be empathetic and try to be professional. Take a professional tone meanwhile being empathetic. So if there is anyone else who will play the role player, I will play the doctor and I'll try to demonstrate by what I mean. Anybody up or shall I take Dr. Tabinda again? Anybody, I need someone. Guys, please do not be scared of me. If you're not opting for this now, then you will have some problem at the exam day. This is a practice session. I'm not going to judge you. I'm not going to give you marks. And now for now you're just going to play the patient. Is there anyone who is going to play the patient? No. Okay, Dr. Tabinda, you know what? Just be the
Yes,
patient
sir.
now and I'll be the doctor. Okay?
Okay, sir.
Okay, so first of all, the first mistake that you did is was the introduction. You did the introduction well, but now I will tell you how to do the introduction. Is okay. So I'll start the that hello.
Hello.
My name is Dr. Kashif. I can see that you have been presented in the emergency department for the past 2 hours, and
Mm-hmm.
I can see that your son has been retained in the emergency department, has been kept on the fluids. Um, can you please tell me And as we have seen your child, and we can see that he is making progress, fortunately, and your child is ready to be discharged. Do you have any questions so far? So this is the first thing, Dr. Tabinda.
Mm-hmm.
This is the first thing. He is in the emergency department. He has been there for the past 2 hours. So probably you or someone else, probably not probably, someone else have been, he has been seen some by some other doctors. So it is a good, what you did was, the thing I liked about you is you asked the patient name, sorry, the parent name, which is very good, but it was very irrelevant to ask him or her about her age. Like it has nothing to do with the
Yes, yes,
conversation, absolutely
yes, yes.
nothing. Okay, you can ask them,
Mm-hmm.
okay, my name is Dr. Kashifas. Can you please tell me your name? Why haven't I asked your name right now? Because before the speaking starts, you will have 2 minutes with the invigilator. In that time, you can ask the invigilator, shall I address you by your name? If you want me to address you by your name, what exactly is your name? So in that time phase, you can ask them their name. But now, as it is the emergency department, so please understand the patient is there for the 2 hours. So probably you will be you know his name and you know the child name. So it's not a good idea to ask their name. Yes, you can tell them, you can introduce yourself. My name is Dr. Kashif. I have been told by my seniors to update you about your child condition. So you're playing safe here. You're introducing yourself and you're also trying to incorporate that you have been told by your seniors to see this patient or see this parent and update him or her about the child condition. So as I've started, I have told you my name is Dr. Kashif. I have been told by my seniors to come up to you and tell you about your child. As I can see from my notes that your child had a history of recurrent vomiting and stomach pain, and we diagnosed it as a viral gastroenteritis. Now that he
Mm-hmm.
has been here for 2 hours and has uh, given some fluids, he is feeling better and happy to tell you that he is ready to be discharged. Do you have any concerns? Do you have any questions that you want to ask?
Okay. I want to ask you that I don't know what is gastroenteritis, and I don't know from how my son get this gastroenteritis, doctor.
I can totally understand. I can totally understand. It's really hard for someone who is not from medical background to know what viral
Mm-hmm.
gastroenteritis is. So, to put it in a simpler manner, it is a kind of infection which is caused by viruses. Okay, so there are different type of bugs. It can be a parasite, it can be a bacteria, it can be a virus. But in the case of your son, it is a viral cause. So what it has done is it has irritated the lining of the stomach or intestine, or you can say tummy, the inner line of the tummy. The bug has irritated it, and because of that, your son has an infection. And for with that infection, he is having the problem of vomiting and as well as stomach pain. Okay, are you getting this information? Are you getting me?
Yes.
Okay.
Okay. Okay. So, doctor, I'm much concerned about my son. You are saying that he's ready to discharge, but my son is looking
Mhm.
very weak, and I want to keep my son in hospital, doctor, for better care.
You have missed another question, Dr. Tabinda.
Yeah.
What is the second question?
Uh, I want to know, doctor, that from where my son got this viral gastroenteritis, because he
Okay.
always stays with me. So this is.
Okay, no problem. See, so the thing is, as I mentioned you, that the cause is viral. So with viral diseases or with viral infections, it's really hard to know from where the patient has gotten the infection. But these viral conditions, they spread very fast and then can be spread with contact with feces or vomiting. And as sometimes the child, they are not very sorry, particular about hygiene, so they may put their hands in some kind of dirty water or water which has been contaminated with feces or vomiting, or even shaking hands with people
Mhm.
who have the same infection, or sometimes touching the objects, the foods, or anything which has brought to the home outside. has been contaminated from this virus. So they are, as they are not very particular about hygiene, that they touch those things and then they put their hands into the mouth. That is one of the reason. That is one of the
Mhm.
way this virus has spreaded, or the child can get infection. Okay.
Okay, doctor, but I want to tell you that my son is looking very weak, so I want to keep my son in hospital for a few days. What do you think about it?
Can you please tell me why do you want to keep your son in the
Because,
hospital?
doctor, I'm a single parent and I stay alone at home, and I don't think so that I can take care of my son at my home.
I can understand where you're coming from, and I can totally understand being a single parent is hard, and it can be challenging to take care of son when you are single and also you're working. But in your case, what I will advise you is it's not a good idea to keep your son in the hospital, as he's still in in that infective period, and as he is in that infective period, he is more prone to get some more infections from the hospital, as hospital has different type of patients coming in, different types of instruments there. So it can your son can have an infection from the hospital. But as you mentioned that you're concerned about your son taking home, it's with this infection, you do not have to be very particular. All you need to take care is about your son fluids. You have to make sure that he is having
Mm-hmm.
appropriate enough fluids, which can be given in the form of juices, which can be given in the form of water, or I will provide you some sachet. You can mix it in the water. All you have to make sure that he is well hydrated. That is all. That is all that need to make sure. Okay. Other than
Doctor,
that,
but I'm upset that if my son condition will get worse at home, what I will do. So I'm concerned about it, doctor.
okay, I understand, and your concern is really valid. So, if you're first of all, how would you know that your son condition is getting worse? For example, if he has more episodes of vomiting, or he is being, not being attentive, or he is being lethargic, he's being irritable. These are some of the signs that that the condition is not getting better. The fluid therapy that you're giving at home is not working properly. In this kind of incident, you can rush back to the hospital, you can rush back to the emergency department, and we will take care of your son. But it's very unlikely that it is going to happen. But you need to know what are the signs, what are the things. If you see in your son, you need to rush back to the hospital. Okay, I'll provide you with a leaflet that has
Okay.
enough information. When you are going back home on your way, or when you are at home, please try to read that leaflet. It has much information about the symptoms and signs. And if you, unfortunately, if you see that in your son, you can rush back to the hospital. Okay.
Okay,
You
doctor.
have any other
Yeah, yeah,
questions?
yeah. Doctor, I'm feeling better and I think I should take my son home and I'll contact you in case of any emergency. Thank you, doctor.
Perfect.
Thank
I'm
you.
really happy. I'm really happy. And please do come back to the hospital if you feel, that your son is not getting better. And thank you so much. Hello. So, see, Dr. Tapinda, this is, I'm not perfect at all. I know I had make some mistakes or whatever, but this is how you take on the speaking session with confidence, and you have to be very smooth. Again, one mistake that you did at last is that I'll provide you with my contact information. So it is not advisable for doctors to share their personal information. You can always say that I'll provide you with a leaflet of this disease. Okay. So in other countries, in developed countries, they have leaflets of where every common
Sir,
disease.
like I want to ask you that I do speaking very fast. That's why I was taking pauses. So
Yes.
was it slow?
So you have seen my pace as
Yeah,
well.
yeah,
I
yeah.
was very slow, and I'm sure I haven't kept the timer, but I'm sure it was within 5 minutes. So you have to keep your tone, you have to keep your pace, not very low, but at a medium pace. Okay. And as you are right, you were trying to rush. You do not have to rush. Keep your pace at medium level, and then these are four questions. What, five questions? Only five questions. If you even if you take 1 minute for one question, you will easily cover all these questions. Okay.
Okay, sir, thank you.
Um, no problem. I have another scenario with me. I have another card with me as well. Do I have any other candidate who is up for practice? Anybody? Amjad, Mansha, Munesh, Ikra, Gagan, Khatija, Khayyam, Mahesh, Sadia, Salman, anyone who is up for practice? Guys, tell me so that I will share with you the other card as well. Before I share the other card, let me give you another. Let me share another one. This one, yes. Okay, everybody, see this, Dr. Tabinda, especially you. I will be sharing this screen. I have actually wrote this conversation. See, this is the card that we practiced. So I have written a conversation. You do not, please, Dr. Tabinda, please, you do not have to memorize it. Okay, please do not. See, this is how I was just I have kept it that good afternoon. I understand you have been here for a couple of hours with your son. I have reviewed his situation and it seems he is ready to be discharged. Before we proceed, do you have any other questions or anything you would like to discuss? See, there is no introduction. Okay. And it's always good to say good afternoon, good morning, good night, not good night, but whatever the time at that whatever the time is at that particular period, it's always good to say that. And the parents say, yes, actually the doctor mentioned my son has viral gastroenteritis, but I don't really understand what that is. Can you explain it to me? Of course, I'm happy to explain. Viral gastroenteritis is essentially an upset of the stomach and intestines by a viral infection. The irritation can lead to the symptoms like vomiting, stomach pain, and diarrhea, and it's quite common in children and usually resolves with proper care at home. Okay, one thing I will add try to add here is you can always you for example stomach and intestine. Yes, everybody knows what stomach and intestine is, but you can always use the word tummy as well because it's a name and a word, so you can always use the word tummy as well. Parents say, how did he get it? We are always very careful. It spreads quite easily, unfortunately, through contact with vomiting or with vomit or feces on an infected person. It can happen through shaking hands, touching contaminated object, or consuming contaminated food or water. Not a reflection of your cleanliness or care. These viruses are just highly infectious. Okay. He looks very weak. I think he should be in the hospital. I understand your concern, but the best treatment for viral gastroenteritis is usually staying hydrated with oral rehydrated solutions, which can be effectively managed at home. Hospitalization is really necessary. We have observed him for a couple of hours on rehydration fluid, and he has responded well. What if he feels to starts to feel worse at home? I'm worried. Let's make sure you are fully prepared for home care. Keep offering him small, frequent sips of water. Avoid sugary or dairy products for now, as they can worsen the diarrhea. Watch for signs of dehydration like frequent urination, extreme thirst, lethargy, or irritability. If you notice this or if his condition worsens, please bring back him to the hospital. Okay, that makes me feel a bit better knowing what to look out for and when to come back. I'm glad to hear that. Remember, it's important to follow these guidelines closely at home. Do you have any other questions? No, thank you. You're welcome. If anything comes up, do not hesitate to contact us. Take care, and I hope your son feels better soon. See, it's a very smooth and very to the point conversation. So I will share these slides in the group, but before that, I want to know if anybody is up for another practice session or not. Or do you guys have any other question, or do you guys want to know anything? Please type in or open your mic or just ask me. I'm happy to help. I'm happy to answer your questions and your queries. Sadia, Salman, Mahesh, Khayyam, Khatija, anybody? You guys have any questions? What if you not complete the task? Mahesh, if you not complete the task, the time will stop and they will tell you to stop. They will just stop you from speaking or what at whatever question you will be there, you will be on, they'll stop you. Khayyam, and you will lose marks. Of course, you will lose marks. Khayyam is, do we have to know about patient intro in case of emergency? Khayyam, as I told you and as they demonstrated as well, if it's an an emergency setting, you do not have to introduce yourself, okay? Or if you want to introduce yourself, you can introduce yourself in a way that, hello, my name is Dr. Khayyam. I have been asked by my senior to update you about your son's condition. If you want to, you can, introduce yourself in this way. Otherwise, it's just if the scenario is emergency setting, you just have to say, good afternoon, I'm here to update you about your son's condition. That's it. You do not have to introduce. And even if you're confused, still you are confused, you will have 2 minutes before the scenario starts. In those 2 minutes, you can ask the examiner, and they are very helpful. They are very cooperative. You can ask them that I can see that it's an emergency setting. Shall I introduce myself or not? If they say yes, no, just ask them what is okay, just to address you. What? How can I address you? What is your name, or what name shall I use you to address you? Okay, these are the things that you can use. Okay, either you can introduce yourself just by saying that I have been told by my seniors, or you can just skip the introduction and go, just jump start the conversation by saying good afternoon, I'm here to update you. Or you can, use those 2 minutes wisely and ask the examiner himself or herself. Okay. Anybody that's, so we don't, guys don't have too much time. We have only like half an hour remaining in the session. I want to practice another card, but I want to know if there is anyone who is up for practicing, because it's useless for me to just speak if you guys are not, you know taking part here. It's, if it's an interactive session, it will help you guys as well, because I'm done with my OET. I do not want to sit OET again. You guys are there. Dr. Tabinta, you want to do it again? Okay, no problem. But I just want to know if there is any other person who want to practice again, or who wants to practice, not again, sorry. Dr. Khayyam, do you want to practice?
Yes, doctor.
Okay, perfect. Okay, what I will do right now is I will present you with the card, okay, which will be your card, but I will not show the role player card now. Okay,
Okay.
sorry, did you say something?
No, I mean okay.
Okay, perfect. Dr. Okay, before that, any people who are attending the session, can you just please type in your dates of exam? I want to know when are you going to take your exam, so I have an idea. Dr. Tabinda is taking on 1st of June. Okay, anybody else who has booked the exam? I just want to know. Khayyam, 1st June. Other than Khayyam and Dr. Tabinda, anybody else who has booked the exam? Okay, Gagan, no problem. Anybody who has booked the exam, so I know when are you guys going to appear in the exam? Just two, just two of you, Dr. Tabinda and Khayyam. Nobody else? I haven't booked the exam. Okay. Anybody who has booked the exam, if you haven't booked the exam, no problem, no problem. You guys can attend the session and have an idea of how the exam is. But okay, no problem. Dr. Khayyam, are you there with me?
Yes, doctor.
Okay, perfect. Is this your first attempt of OET, Dr. Khayyam?
Yeah, it's my first attempt.
Okay. Okay, Khayyam, I am sharing the screen with you. Okay. Can you see the screen?
Yeah, I can see it.
Okay. Again, I'm not going to put on the timer. You can read it out loud, and or you can just take your time, read it, and whenever you are ready, tell me, and we'll start the scenario.
Okay, I will try to read it.
Okay.
So, your 34-year-old patient, a dancer, has had
Yes.
a Baker's cyst, a popliteal cyst on the back of the knee for a few months. At the first presentation, you decided to observe it. You are now reviewing the patient who believes the cyst is increasing in size.
Mm-hmm.
However, you measure the cyst and determine that it has not increased.
Hmm.
Do I have to read the task?
Sorry? No, you don't have to read the task. Just take your time, and whenever you're ready to start the conversation, just tell me and we'll start the conversation.
Okay, I will take a minute or two.
No problem.
Okay, so can we start?
Yeah, sure, sure.
So, hello, uh, uh, do you hear me?
Yes, yes, I can hear you.
Okay, so you are not supposed to show the your play card now?
I have my play card. I'm waiting for you to start.
Okay. Hello, good night. My name is Dr. Khayyam. I will be your treating doctor today. How may I address you?
You can call me Sarah.
Sarah. So, Sarah, how may I help you today?
Uh, Doctor, I am a dancer. I'm 34-year-old, and I have this growing on my left knee, and I think it has been going on. It has been increasing for the past few months. I have seen the doctor in the past, and he told me that we need to keep it under observation. But now I think it is growing in size, and it is looking large. And as I told you that I'm a dancer, so I'm really concerned about how I look and how I perform, and it is just you know messing up with my confidence and ultimately with my performances as well.
Okay, Sarah, I can understand your concerns, but would you like to tell me, do you suffer any type of
Any type of sorry?
pain?
No, I do not have any type of pain.
Okay, and are you experiencing any reduction in the moment?
Not really. I'm not experiencing any problem in movement.
Okay, that sounds good. I would like to continue to observe your cyst, uh, as I haven't seen any symptoms or any
Okay.
enlargement of your cyst.
Okay.
Uh, I would like to tell you to continue your current treatment, you should continue with your physio, applying ice on the cyst, and
Mm-hmm.
you should wear supportive footwear. Are
Mm-hmm.
you getting me?
I'm getting you, but doctor, but the thing is, I have been following this treatment plan. I have been following physio. I have been applying eyes, and I have been wearing supportive footwear. But as I have a very busy schedule coming up, I have lots of performances in the coming weeks to perform, and I want to make sure that this is doesn't grow. And as I mentioned that I have been following the treatment that has been prescribed to me, I think it's just not working for me. Can you please tell me any other option other than this? I want to know all the possible options for the treatment of this cyst.
Yeah, I can understand it must be stressful for you, but I can recommend some future treatment, you can review your symptoms by a sports physician, an
Mm-hmm.
orthopedic surgeon, and you can undergo a knee arthroscopy to evaluate
Mm-hmm.
your knee injury, or to look for some degenerative changes. Do you understand? You know?
I do understand. Yes, I do understand. But do I have to go through all of this?
Yeah, I would like to seek uh, all these treatments, and
Mm-hmm.
I will recommend it.
Okay. Okay, doctor. Whatever you say.
Uh, uh, Also, I would like to add that you review your symptom. You review in another 3 months.
Okay. Okay, doctor.
Uh,
Okay.
do you have any other concerns?
No, nothing.
Okay, thank you. I believe I may have
Yes,
covered
you
all
have
your
been.
symptoms.
Yes.
Okay, thank you.
Okay, we will end the session. See, Dr. Khayyam, again, the problem, as I said, I'm here to help you. Why exactly the session? I think it wasn't that great. Why? First of all, you have been like you were very reluctant. Okay, I could feel the reluctance in your speech, in your approach. Okay, and other than that, again, when you have been given the task, there are only four questions. See, this scenario is difficult as compared to the previous one. It has only four questions and you have 5 minutes. Okay, you have to take your time and you have to be very smooth about. I can totally understand this is your very first time practicing this session. No problem. In the coming days we will practice more and more scenarios, but I'm just trying to give you a feedback of yours, how you can improve your speaking skill. You have taken your time, you have read the task. In your mind you can make a structure that, okay, I will say, good afternoon, my name is Dr. Khayyam, I am your doctor. As it is mentioned that it is a clinical setting, you have to introduce yourself. Okay, you have to tell them that you're going to see the patient and you have, it's a good, yeah, it's your first cut, and it is a good idea also to ask the patient name. Okay, and then tell them, okay, can you please tell me what brings you to the hospital or what brings you to the clinic today, or how can I help you today. Then the patient will start that I am a dancer, I have this cyst on the back of my knee and whatever. And then you ask the patient about new symptoms. Okay, now you're a doctor. It's written there are only two new symptoms that are written: pain and reduced movement. But try to think, as you are taking your time while reading the task, what are the other symptoms that a patient can have with the cyst. It can be pain, it can be reduced movement, it can also, you can also ask, have you noticed any change in the color, is there any discharge, can you walk well, okay, can you sleep well, is it bothering you, okay, is it irritating, these kinds of things. You can all just try to think, this patient is in your clinic, what are some, just add two or three things more in it, for I mean, it's only written pain and reduced movement. You can ask changes in the color, you can ask about discharge, you can also ask them about the temperature. Do you feel any coldness or warmth in this swelling? Okay, now that you have asked about new symptoms, then you can tell them that, that we will continue. I have told you that my previous doctor have told me that we will observe it, and then you will tell we will keep it under observation as there are no new symptoms, which is a good sign. Okay, and I have measured your swelling, and fortunately it has not improved, it has not increased in sign, which is a good sign. So we'll keep it under observation, and I will encourage you to keep with the current treatment that you're going through, which is physio, applying ice, supporting footwear. And now when the patient says that I have a busy schedule and I have have tried these, but it has not given me any kind of outcome, and I want to know, is there any option for other treatment? You can say yes. What is written here? It is written, discuss possible future treatment. It is a possible option. You can tell them, okay, there are some possible future treatment, possible future options, that we can get it reviewed by a sports physician, we can also get it reviewed by orthopedic surgeon, and if needed, you may go under knee arthroscopy to evaluate, or we can also try to look what is underlying the mechanism. But these are all the future mechanisms. But for now, I will try to encourage you, I will try to tell you that please keep on with the, or please stick to the previous treatment, because it is, even if it's not working, the good sign is it is not improving in sign, which itself shows that the that supportive treatment is working on you. Simple. And we will review it, or we will make a follow up in another 3 months to see how you are responding to that supportive treatment. Okay, this is how you will carry. Now I will show you the role play card. Okay, wait. See, now this is the role play card. I will encourage you, where exactly? See, what is written here? Reluctantly agreed to follow the doctor advice. It is in the given. It is given in the role player card that you do not have to agree with the doctors. But again, I haven't seen any effort from the doctor. It is my task that I should not agree to or get discouraged whenever the patient is not agreeing to your advice. But again, you, because you don't know what is in their card, but you have to make sure that you are giving your best. It can happen the the role player or the patient can agree, that he can say, okay, no problem, you know what, I will just follow the supportive treatment and we'll see another 3 months. I am reluctantly agreeing to your advice. I'm not happily agreeing to your advice, but I'm reluctantly agreeing to your advice. Okay. So this was another scenario, but it's no problem. It was your first session, guys. Please do not be discouraged. Actually, I'm very happy that I had two people volunteered, and both of you guys have exam exactly after 1 month. So please keep practicing speaking. It has to come naturally, and you do not have to force yourself. Okay, take your time, make a structure in your mind. Okay, and then speak. Do you guys have any other questions? Anyone? This is revisit. How to introduce Mahesh? I do not understand revisit. I mean, you are revisiting.
Sir, actually, this patient, as I concerned this one, this was a revisit because patient
Okay.
first came in our clinic, then we have keep on follow up. This is second visit of
Okay.
patient with us. So can we introduce same like my name is the information of what is your name, like this,
See,
or either we can say yes. As a reminder, my name is actually my name is Dr. Mahesh Kumar. I am in this clinic. Can you remind me your name like this, or just we can? What is your name?
See, this is a very good question. See, as it is a revisit and it's revisit of the patient, it's a good idea to introduce yourself. Okay, because you, as I mentioned, that you do not have an idea that if the patient in on the first visit, if he or she has been seen by you or by another doctor. Okay, but in this scenario I will always advise you to please introduce yourself. But in this card it is written that you decided to observe it. Okay, so you can tell them, hello again, my name is Dr. Kashif, and it's happy to see you again. Can you please tell me what's going on and how you are coping with your problem? You can do like this. Again, as I said it earlier as well, that even if you guys are confused that I am not sure what to do and what to not, you can always ask the examiner. Okay, I'm telling you this from personal experience. The examiner there, they will tell you that, what, skip the introduction and just jump into the card. But it's always a good idea to introduce yourself. You can always improvise. In this scenario you can tell them, hello again, my name is Dr. Kashif, as we have met before. I'm happy to see you again. Can you please tell me how can I help you today? Okay, so in this manner you have introduced yourself and you have also made sure that you are familiar with the patient and you are not being awkward to them. Okay. Mahesh, did you get me? Okay, perfect. I can see your animation on the screen. Anybody else? Do you guys have any other questions? Anybody? Mahesh, do you have you booked your exam?
Yes, sir.
Or when exactly is it? What is the date of your
Uh,
exam?
18th May.
18th of May. Okay. Okay. You know what? I'm just keeping a record of everybody who has the exam so I can ask you guys about the results. And this is your first attempt?
Yes, sir.
Okay. Anyways, good luck, and we will be here for you and we will be practicing. So if you have any other question or thing, please do not hesitate to ask. Okay.
Sure, sir. Sure.
Dr. Tabinda, are you clear on this speaking, or do you have any other questions as well? I think she's not here with us. No problem. Anybody else? Khayyam, do you have any other questions? Okay. Thanks a lot. Okay. No problem, Khayyam. Happy to help. Okay, guys, I'm going to end this session now. Okay, it's also namaz time, so it's good that we guys pray as well. So it was just a little bit introduction, not introduction, but it a little of dive in this speaking session. So now we understand how we should introduce ourselves, how we should take on the speaking. And honestly speaking, this is all about speaking. We will have more sessions of speaking, but in those sessions, I will be practicing with you guys. Okay, I'm not going to dive in and show you slides that I have that I did today. But now that you guys have a rough idea how to start, how to keep on going, how to play with your tone, how to play with your knowledge. Okay. So in the future speaking sessions, we will have three more sessions of speaking. We will be practicing a lot and maybe more than two cuts. Okay. Okay. It's when is the next session of speaking? Mahesh, the next speaking session, I don't clearly remember which. I think the I, I don't know if the curriculum has been shared with you or not, but it will be shared with you in the WhatsApp group. Okay. So everybody take care of yourselves. Have a good night and keep practicing. And I'm here to help you. And we will see each again. We will see each other again tomorrow. Okay. Okay. Take care of yourself and good night.